Morning, everyone. Welcome to the Washington County Human Service meeting. We are opening at 10:03, and we are looking to accept the minutes of June 29th of 2020.
I'll make that motion.
Thanks, Paul. Paul has made the motion. Jay seconds. All in favor?
Aye.
Aye.
Thank you. We're going to go down into department request. Gina is here.
Good morning.
Good morning, Gina.
I have the item to update everyone on the COVID-19 stimulus ADRC funds. So I just wanted to let everyone know that at the time, Office for Aging is in receipt of the notification of grant award for the COVID-19 ADRC stimulus funds in the amount of $22,928. At this time, I am in receipt of the guidance for the use of the funds, but I'm still working internally and with the state on a plan that is truly in the best interest of the Washington County residents for the use of the funds. So my intention is at this point that once a plan is developed, to share it with the county administrator and our budget officer for approval. And then once that step is taken, to bring it back to our committee and ask for the funds to be recognized at that particular time.
Thank you very much. Do you need anything from us?
Not at this point, really truly just to update you on the use of the funds.
Thank you.
You're welcome.
So, anything else, Gina?
I don't. I do have a request for Commissioner DeLorme, and I'm not sure where you want me to go on the agenda for that item.
If you want to go ahead now, that would be fine.
Sure. So for DSS, on behalf of Commissioner Tammy DeLorme, I'd like to share with you that DSS had a recent retirement from a long-term employee. This employee served in the accounting unit. The position that the employee held was fundamental for the accounting operations for both DSS and OFA. At this particular time, based on this vacancy and the duties that this position demands, Commissioner DeLorme would like to make a request to backfill this position under the current existing grade and title of Accounting Supervisor Grade B.
And do we have a motion from the committee to,
I'll make that motion.
okay. Do we have a second?
Second, are we moving it to personnel? Is that where we move? Is it moving it to personnel? Is that what we're doing?
Yes.
Correct.
Yes.
Okay. Yep.
Okay. All in favor of that?
Aye.
Aye.
Aye. Okay, moved. Thank you. Gina, anything else?
That's it. Thank you very much for your time.
Oh, you're welcome. Thank you for your time. We'll talk later. Okay. Now we're going into veterans. Is Ken here? I think I saw him earlier. Here we go. Hi, Ken.
Hi, I'm here.
Yes.
I don't have any requests, just department updates, if you want me to go ahead with that.
That would be wonderful. Thank you.
I know it's a little while since anybody's kind of heard me speak, so I figured I'd give you guys a bit of an update on our office. Throughout the show, everything we ran as smooth as possible. The office continued to run. The purchase of the Vet Pro software to allow us to file claims at the end of last year really provided us with the ability to continue operating our office even remotely. That everything from submitting claims and collecting digital signatures, we were able to continue throughout the shutdown. I think we have about, since March, Vet Pro is also providing us with a limited amount of reporting numbers. And it looks like we have about 274 actions or claims that were processed since March. So with that, we're also able to do appointments remotely, either in a resident's home or out, in a public meeting somewhere, using the web-based software that we have. Our transportation to the Albany VA continues. The Albany VA is still closed except for critical care appointments. So we are getting veterans to those critical care appointments down in Albany. But I just wanted to, put that out there and let everybody know we're kind of more or less a mobile office in large at this point. And that, if we can provide that appointment somewhere where we can, continue to socially distance, then it's really worked well, especially with this software program we have. But other than that, that's all I have.
Does anyone have any questions for Ken? Go ahead, Don.
Ken, is the Glens Falls satellite office open? Yeah,
The outpatient clinic,
yes.
it's still closed. Again, the critical care appointments are all being directed to Albany. There may be certain healthcare items you can from the Glens Falls clinic, but they're continue to be closed. On the benefit side of the house, where we largely deal with the claims and stuff, the New York office is still closed. In years past, we would coordinate with them or the Legion office that's right next door in the city, and process claims through them. But they continue to be closed. So we're basically directly submitting anything straight to the VA. The Glens Falls outpatient clinic is still limited capacity, but we're meeting with the administrator, Jill, there to try to determine what the best options are for them moving forward. And they're keeping us up to date as far as when they're going to be back open to the public and making appointments regularly. A lot of the appointments are being done through telehealth, much like these Zoom meetings, if possible, but any kind of specialty care or critical care appointments are all Albany VA.
Well, thank you. I've had several Zoom calls with them at Glens Falls, and they're really good clinic, and I appreciate your time with them.
Absolutely.
Ken,
Yes.
yesterday I saw your mobile bus in front of Stewart's with the dog that was going on to the bus, and that dog is so well outfitted, and everybody loves him. That was impressive and good to see. So thank you for being out and about in our communities.
I know the veteran that you're talking about, whose dog that is, and that was provided by the VA. The VA actually trained the dog and paid for that, and has insurance on the dog. They do a real good job as far as having that a support dog, and it's helped that veteran out quite a bit.
Yeah, it was very sweet to see. So thank you. Anyone else have any questions for Ken? Thank you. Thanks for doing such good work.
Thank you, guys.
Okay, so now we're going into Youth Bureau. Mike Gray.
Good morning.
Good morning.
Good morning, everyone. I just want to give you a quick update on a couple activities. First, summer youth program. We currently have 9 youth involved in the program. This program is a collaboration with DSS using SDSJP funding. So we're very fortunate to have that relationship. A little bit about the program elements. Each youth has to go through goal setting, fiscal management, planning, and opening up a bank account. And the one criteria is these youth, to use SDSJP funding, they have to meet a state requirement of being identified as at risk. So the youth that we have involved are youth that are involved in foster care and justice system. So for those youth with substance abuse issues, they can work while they're in our team setting, but they're not able to collect a paycheck until they test clean. So we're incentivizing that as well. And we've been very successful with that criteria so far. So some of the activities they've been involved with, the work, the job sites include some of the garbage pickup over on the Batten Kill. So they've been over there the last 3 weeks, picking up the 5 spots, Eagleville, the parking area on 313, Tackle Box, Georgia Museum, and Rexley Covered Bridge. They'll be over there weekly until into the fall. Then there's also, they've been doing car washes, mowing, and trash pickup along Route 4. So that's a section of highway that we have adopted. So they've been busy, and I'm really thankful that we give these youth this opportunity. I've seen a lot of growth in them. They're evaluated every 2 weeks to talk about their performance, and it's been a great experience. So that's that program as it stands now. Are there any questions at all?
Yeah.
Okay.
Thank you, Mike.
Well, and then the next, just an update is on July 31st, we went to Lake Lauderdale to work with the Greenwich Rec program. We provided some games and activities, include geocaching, different baseball and softball toss, and different board games. We had planned to do some canoeing there. We had a certified lifeguard on staff, but Department of Health showed up and said because it wasn't written in their original day camp plan, they wouldn't allow us to do it. So in further discussion with Department of Health reps, I've asked that they sit down, early fall to talk about the requirements, because in the future for rec programs or anyone licensed under the Department of Health day camps for kids to miss opportunities that are perfectly safe, I think that needs to be reviewed and fleshed out. And our office will be glad to work with any municipality that's dealing with Department of Health to help try to work through the requirements. So I'll offer that up.
Thank you.
All right. And that's
Anyone
all.
have any questions for Mike? Dan or Don? Sorry.
I'd like to thank Mike. It was a great couple days for the kids up at Lauderdale. He put on a couple of events for us there. It helped break up the summer routine for us. And like Mike, I've been talking to the Department of Health, and they're tough to deal with. And Mike and I are going to work together and try to put a plan together to avoid some of the craziness that occurs with it. But I'd like to thank Mike and the staff. It was a great couple of days our kids had up there. And maybe New York State will release some of the funding soon, Mike.
Let's hope so, Dan.
Okay. Thank you very much, Mike. Appreciate it.
You're welcome. Thank you.
And Mike, I want to say the same thing regarding the Bentonville River, and we're working towards cleaning that up. It's settling down a little bit up there, I think, from Jay's point of view and my point of view, probably. I can't speak for Jay, but it seems like that as the summer goes on, that it's not to the degree it is 4th of July and at the beginning of the season. But I really thank you all for doing all that you're doing.
You're welcome.
Greatly. So,
I'll pass it on.
thank you. Okay. Anyone other things that you want to talk to Mike about? With that, we'll move on to Patty's back from vacation. I think I saw her. Patty?
Yeah,
Are
it
you
feels
on?
like it's been a long time since vacation happened.
Well, glad you went and glad you were able to.
Yeah,
Happy
it
to have you.
was. Thank you.
Yeah.
The first agenda item I have is related to our preschool special education transportation contract. We're in year 4 of a potential renewal of the contract that was written into the original bid award. And we would recommend that we move forward with that renewal with Durham Transportation. Increases are based upon the CPI. And Tina McDougall is here in the room with me. She is social distance, so I don't have to wear a mask while I speak to you. So she reviews the CPI every year for any increase. There is no increase this year. However, we wanted to let you know that Durham is working on a proposal to request an increase based upon the increased needs that they'll have to attend to related to COVID and the health and transportation requirements related to cleaning, disinfection, having people on the bus, the need to, observe the children, make sure they're healthy, fever-free, etc. So we have not yet received that from them, but we would like permission to go into the next year renewal. And based upon what we know today, sans that proposal, we would be moving forward at the same rate currently as we're paying for this school year. But we'd like to get them on board for the September start of school.
I'll move it.
Thank you, Jay. Do we have a second? Paul?
Second.
Okay. And Don? Anyone else? Okay, all in favor?
Aye.
Thank you, Patty.
Thank you. The next agenda item is just to give you a little update. We continue 7-day-a-week operations. You can see from the daily postings that our numbers are better. We're currently following 3 known positive cases. We have 182 people under monitoring. About 50% of the people who are in quarantine are travel-related individuals, and that varies day to day, but according to the latest numbers, that means they travel to an area that the governor has indicated requires monitoring on return. And when they return, we are, required to check in with them for 14 days to make sure they remain symptom-free. 237 people have recovered currently, and blessedly, we have no one hospitalized. And again, I say it with a great deal of thankfulness, we have no further deaths. But, we get calls every day. There's a lot of follow-up work. We do have a nurse who is out right now for a couple of months. And we've been able to fill in with a nurse we were allowed to hire during the height of the COVID. So that has helped. And right now we're maintaining fairly well. We've been rotating people out for vacation to give them some respite. In the anticipation and not knowing what's coming at us in the next few weeks and months. In that vein, we know that school starting is going to be an increased strain on the department. We're hoping, things will go very well. We've done a lot of work in collaboration with public safety, Tim and Glenn, to prepare school nurses, discuss scenarios with superintendents. We've had multiple Zoom calls. We've tried to put out recommendations that are based upon current Department of Health guidance. We are waiting some guidance. We've been waiting about 3 weeks for guidance that will affect how the schools handle children who become symptomatic. We're told it's at the governor's office and awaiting release. Our fear is that we're continuing to plan based upon current guidance. We met with the nurses yesterday via a Zoom call, but that guidance could substantially change our recommendations and how we work and how they look at things. So we're anxiously awaiting that. Our association is pressing the health department to get those out prior to school starting, so we don't start going down one lane and then have to make a shift while they're dealing with bringing people back into their buildings. They are diligent. They're working very hard. The staff here has been up to our necks in this since March, and they're coming into it, with some background, but we're trying to be as best a resource we can to them while still maintaining the daily call volume and quarantines and, isolations, things like that. So that has been, a lot of work. The nurses are working on some matrices. We put out a kind of an algorithm with some basic information, and we provided a chart with local testing resources for the schools yesterday. And they know it's based on, could change at any moment if and when that new guidance comes out. gyms. I'm sure you're all aware that the governor a week ago announced that we were responsible for inspecting gyms to get them operating. Our district office made it clear that the guidance did not include them. They are typically the ones who do inspections of restaurants, tattoo parlors, piercing, tanning facilities. They're used to going in and inspecting. And we're considered a partial service county. We do not. In discussions with our team, we did graciously receive help through public safety and some of their resources because the gyms could start operating on Monday, the 24th, but they have to be inspected within, I think it's 2 weeks, a week to two. I apologize for not having that in the front of my brain. So it's incumbent upon us to get out there so they can remain open and you know, this is their livelihood. We certainly understand their desire to get going and stay open and do it safely. And they do want to do it safely. So that plan came together within 24 hours. And they are currently, it's up on the website. So the documents that are going to be required of them and the attestations that are required of them prior to their in-person inspection are posted. We fielded multiple calls related to that and providing guidance and where to go for the forms and answering questions. That too has taken up a considerable amount of time and time well spent because this is, you know, definitely needed. But it's just one more thing on the lazy Susan of life right now. They're doing well, they're being diligent, and we're working together on getting that accomplished as soon as possible. One of the things that is most difficult, I mean, certainly we know about disinfection, we know about cleaning, mask wearing, that type of thing, is the requirement regarding their HVACs and air handling systems. And admittedly, my environmental health course that I took does not qualify me as an HVAC or air handling specialist, nor do our partners at Public Safety have that. So we did get clarification that we can work with an attestation from their air handling professionals. That's what we're doing. You know, it talks about MERVs 13 filters, 12 filters, 11, and then there's alternatives if their systems are not compatible with those additional filtration systems. So we've been providing what guidance we could on that as well. So if you get calls, we're working through as quickly as we can with the multiple competing priorities we're dealing with. And now our partners of public safety have, you know, been dealing with the recent storms. So rest assured, we're understanding of the immediacy and doing the best we can to attend to it. Talked about travelers. I think that's it by way of update, unless you have questions for me. The good news is I was looking at our 10-day rolling percent positive. We are below 1%. We stand at 0.8% at this time. The Capital District region is at 1%, and that was data that was pulled last evening. It was through August 23rd.
Does anyone have any questions for Patty? I actually have one, Patty. The kids are very excited about starting field hockey and soccer through school sports. And is that part of underneath your hat too?
Not at this time. I mean, we would probably, we have not gotten calls or questions on that yet. I haven't seen the guidance come out, and I know the New York State Public School Athletic Association is involved in that. But, you know, being from a field hockey family, although all the sports are very important, I was glad to see that we could resume.
Yes, and the kids are excited.
Kids and the parents.
Yes. Yes. Thank you. Thank you for all you're doing. Greatly appreciated.
You're welcome. I do have one miscellaneous item if there's no further questions. I just wanted to let you know, I know Kathy McIntyre reported to you on our maiden Rabies Clinic under the current COVID provisions. We're going to do it again in Fort Ann on September 12th at the Fort Ann Highway Garage. It's by appointment only. Starting on the 27th, individuals will be able to call our number 746-2400 to make an appointment and receive the instructions. We do require, if rabies certificate submittal if they have it, so we can give them either the 1 year or the 3 year certificate. They'll be provided instructions on arrival, masking, what to expect. So it's important they call. Appointments will close on September 10th or when all of the slots are filled, just as we did in Greenwich. And a face mask will be required for anyone attending. So they'll be required to be face masks even though they're in their car. Typically the vet techs will come to the car and collect the animals either in the cat carrier or on the leash, and then return them to the owners in their cars. So that's up and coming as well. And I think, the WIC, Pat Rozelle, the WIC coordinator, retired. And we have chosen a new candidate. We're working through personnel now to get the new candidate on the books. So we're very happy to have her, I won't say replacement, her successor in line. And with the approval that we got, Pat is working to train her successor, especially as they formulate their new budget. So it's a good time to bring someone new on, and it's a good time to have Pat here to help guide the process, especially as all of us here are so immersed in the current response efforts. So that's it for me. Thanks.
Thank you, Patty. Okay, so do we have any other business? With that being said, do we have a motion to adjourn? Thank you,
I'll
Paul.
move it.
Second by Jay, second by Don. And thank you very much for coming. And thanks all the department heads.
Thank you. Have a good day.
Have a good day.
Take care.
Take care.